Prinhanda Akriosa. Good afternoon and welcome to Public Health Network Cymru's COVID-19 webinar series. My name is Christian Heathcote-Elliott and I am Principal Public Health Practitioner for the Wider Determinants of Health Unit. Today's webinar focuses on the findings from the Contact Adherence to Self-Isolation Behavioural Insights Survey, CABINS, and Adherence to Confidence Text Survey, ACTS, which looks at the experiences of people who have been asked to self-isolate by NHS Test, Trace, Protect during the pandemic. Many of us will know from either personal experience or the experience of family and friends that adhering to self-isolation guidance can be challenging due to a range of factors, including the type of accommodation we live in, our economic circumstances, or if we're a caregiver or a parent. And therefore really pleased to welcome our speakers, Dr. Richard Kyle and Dr. Kate Isherwood. Richard is Deputy Head of Research and Evaluation Public Health Wales and leads on the CABINS and ACTS surveys, and is also currently involved with research looking at the wider harms of COVID-19. Before joining Public Health Wales in 2020, Richard was a reader and Head of Population and Public Health in the School of Health and Social Care at Edinburgh Napier University. Richard's research interests are wide-ranging and span the fields of public health, nursing, psychosocial oncology, and human geography. Kate is the Senior Research and Evaluation Officer and also works in the Research and Evaluation Division at Public Health Wales. Prior to joining Public Health Wales in 2019, Kate completed her PhD in the effectiveness of using positive psychology interventions to improve psychological well-being. Kate's research interests lie in population health and mental well-being, specifically improving health behaviours and the prevention of mental health conditions. Before handing over to Richard and Kate, just a few housekeeping rules. So after Richard and Kate's presentation, there will be an opportunity for you to ask your questions. If you could use the question and answer box to type in your questions. The webinar is being recorded and will be available on the Public Health Network Cymru's website after the session. English and Welsh subtitles are available and these can be switched on using the button at the bottom right of your screens. And if you do experience any difficulties with the technology, we have technology support today, so please let us know through the questions and answer box. So I'll now hand you over to Richard and Kate.
Thank you very much, Christian, and thank you for the opportunity to present today. It's great to be able to join you to share the work that we've been doing within the Research and Evaluation Division at Public Health Wales over the last several months. And what we're going to do today is just really take you through some of the key findings from two pieces of work that we've been delivering within the Research and Evaluation Division. And that has actually fed into, in a number of different ways, the response to COVID across Wales. And so this insight has actually been feeding in to various different organisations and individuals to guide and shape the response to the pandemic as it has progressed. So specifically, there's two pieces of work that we'd like to talk about today, and I'm going to talk about the first piece of work, which is ACTS, and then I will hand over to Kate, who's going to talk about the second piece of work, which is CABINS. Now, as Christian mentioned, ACTS stands for the Adherence Confidence Text Survey, and CABINS is the Contact Adherence Self-Isolation Behavioural Insights Survey. And we'll go into a little bit more detail about both of those in a second. But one of the really key parts of this work, and as Christian again mentioned, self-isolation is challenging. And when we were thinking this through and setting up these pieces of work, what we wanted to do was to get some insight in a real-time basis. So not just after people have self-isolated, but really to identify as people were being asked to self-isolate at the start of that self-isolation period, what were the sorts of things that were worrying them? What were the sorts of challenges that people thought they might face during that period? And so that really is the key distinction between the two pieces of work. ACTS focuses on the start of someone's period of self-isolation, and CABINS takes that more in-depth look back over a period of self-isolation. So let's turn now to ACTS, and ACTS is a text message survey that is done in real time, One of the things that we identified quite early on in the pandemic was really this need to get some insight into people's feelings and people's views right at the start of this self-isolation period. And one of the ways that this is usually done across the NHS in other different contexts is to kind of get some feedback after people have had contact with an NHS service. So it might be something that actually you've had experience of in the past when you've gone to, say, an outpatient appointment. And usually when people say go to an outpatient appointment, then they might get a text that says actually how was that experience, and then people are asked to send back a certain numeric response, but then also some qualitative responses as well, some free text responses. And this is usually called the Friends and Family Test. It was kind of rolled out a number of years ago, and it's kind of a very standard kind of way that feedback is gained after people have had contact with NHS services. And so what we thought we could do is actually we could use that model and we could slightly change it. We could use it as the platform for the ACTS study. So really ACTS was an incredibly innovative study. It was the only study of its kind across the UK within the pandemic that was giving us daily real-time insight into what people were thinking and feeling at the start of their period of self-isolation. And the way that it worked was that people, when they are identified as a contact of a case of COVID-19, they're then contacted by NHS Wales Test, Trace, Protect, and they're asked at that point to self-isolate. And at the start of this period, that self-isolation period was for 14 days, and then that was subsequently changed in December to 10 days. But also at that point, people in Wales are asked to express a preference for whether they want to be followed up over that self-isolation period by a telephone call or whether they want to be followed up by a text message. And so what we decided to do was we decided to say, well, actually, of those who have decided to be followed up by a text message, let's send them a series of text messages to see if we can get some insight into actually how they're thinking and feeling after having been contacted by NHS Test, Trace, Protect in Wales. So basically people would then receive, after they've been contacted, they've been told that they're a contact of a case of COVID. They are then contacted by NHS Test, Trace, Protect, and then they're sent a text message. And one of the great advantages of this piece of work is that the details and the information of everybody who's a contact in Wales all feeds into the same system. And that system means that on a daily basis, we could go into the system. Subsequently, we've automated the whole process, but we could go into the system, we could identify those people who've been contacted the previous day, and then feed that into a series of text messages that people could then take part in the survey. So those messages, one of the really key things that we wanted to make sure was that people could decide whether they wanted to participate in it, and also, very mindful of our context, make sure that people could participate in English and Welsh. So the very first message that people received was the one on the screen there, was a bilingual opt-in. And that just asked people to say that they've been in contact from Test, Trace, Protect, and we'd just like to ask a few questions about their experiences. And at that point, if people didn't want to participate, they could quite happily say stop, and they wouldn't get any further messages from both at that point, but then also if they were asked to self-isolate at some point in the future. If people did want to participate, then they would get this second message that was there, which was really about confidence to adhere to self-isolation. And the question itself was kept quite open, and we did that quite deliberately. At this stage in the development of the study and development of the progression rather of the pandemic, of course, nobody really knew which way this was going to go. So we wanted to not really refer at that point to any specific period of time for self-isolation, because that might have changed, or to put much detail in there about the specifics at that time point, so that this could be a measure that would be consistent across a number of weeks and months, as it turned out to be. So that key question was really, how confident are you that you know what you need to do now? So that's after somebody's spoken with a contact tracer, they've had that discussion, then how confident are they that they know that they need to self-isolate and what they need to do to make sure that they're able to self-isolate. And it was a very simple response that people sent back. It was whether they, you know, on a 1 to 5 scale, ranging from very confident right the way down to not at all confident. And people just text that number back. If they did that, then they would get another text message which asked them for some more free text feedback. And this was just a bit of service improvement, service evaluation that we were able to then get some data about. And this really asked people to reply to tell us what was good about their experience, but also what we could do better as a result of that initial discussion. And there people could send back anything that they wanted, really. It was like as if you were just texting a friend or a member of your family. You could text whatever you liked at that point. And then finally, if somebody responded to that particular message, then we would thank them for that and then ask them to complete a very short 2-minute online survey. And at that point, it kind of took them off into an online survey that they could then complete, which gave us a wee bit more information about themselves, age and gender and ethnicity, but then also importantly some questions about what they perceived would be the challenges they might face, some other further questions around their experiences of speaking with a contact tracer. But then also one of the real advantages of this piece of work was that we were able to change some of those survey questions again in response to the progression of the pandemic. So, for example, when the idea of bubbling over Christmas was something that was put in place, we were able to add a question in there about whether people formed a bubble or whether they didn't form a bubble. And then also, as you'll see with some of the findings that we'll present, we were also able to sort of add in different options to specific challenges if people were talking a lot more about in sort of other categories about particular challenges. So that's really the design of what we did, and the ACTS study started back in November, on the 11th of November 2020, and it's been sending out text messages every day since. It still sends out messages. The messages will go out again today to those who've been identified as contacts, and will continue for the course of the pandemic, which gives us that real-time insight into people's experiences. For the purposes of this presentation, and there's a report that we produced and we're drawing on that report in our discussions today, what we wanted to do was kind of pull out some initial data from the first period of the ACTS study, and that takes us from the 15th of November to the 9th of January. Now, I just mentioned that the study itself started on the 11th, and then I've just said that the reporting period was the 15th of November. And what we did was we aligned our reporting period to the reporting of the Test, Trace, Protect statistics that Welsh Government put online every week. So that actually the reporting period was consistent. So when people were looking at actually the kind of how many people were going through the Test, Trace, Protect system and how many were reached successfully, then people could actually say, well, actually this is comparable data for that group of people over that same time frame. So within this period, there were 13,531 people who responded to our text. So that's an 8-week period, over 13,000 people. It was a response rate of 31.6%. It's worth noting that the friends and family test on which this is based has a response rate typically of around 25%. So the provider of the text message is very happy, I think, that and we were very happy that we were getting a good response rate to this in comparison to the friends and family test. And then of those 13,531 people, then 3,679 went on to complete the Behavioural Insights survey, and that was a response rate there of 27.2%. I think as at the moment, we've sent over 60,000 text messages to people across Wales who've been asked to self-isolate, and typically it's about 1 in 5 of everybody who's been asked to be a contact in Wales over this time frame that's been part of the ACTS study. So this is quite unusual and quite unprecedented across the UK, and that this is the depth of the study and actually the engagement that we're getting in this particular study. And really what we found from that period, just to come on to some of the findings, was some really positive news for Wales, in that 92.2% of contacts over that period were confident that they understood what was required of them during self-isolation. And that was a really good picture, actually, in terms of that confidence to self-isolate. And it's remained consistently high for all of the period that we're looking at here, but then actually subsequent to that as well. Really, one of the advantages of the way that the study was designed was that we could then start to understand who it was within the population that was more or less confident to self-isolate, and then feed some of that information into our colleagues across government, across our local public health teams, and across Public Health Wales itself, to be able to start to tailor advice and guidance, the contact tracing scripts themselves, as well as more public communication. And what we found that actually, once you started to adjust in our statistical analysis to age and gender and deprivation, and also the reporting week that we were looking at, then actually women were more likely, 1.3 times more likely than men, to report they were confident to self-isolate, and also that confidence was higher among older adults, those who are over 50 years old, and consistently those who are 50 to 59, 60 to 69, and those 70 and over, when you compared that to younger people. So that really highlights that need to focus on particular groups, and particularly younger people at that particular point. If we break this down over time, you can see there the sort of really interesting patterns there. What we've highlighted there in terms of confidence there is that it's really high, above the 90s for most of that 8-week period, and as I say, it's continued in that sort of vein. You'll see there's a slight dip there in week 4. And what's really interesting about that is one of the rationales for the study was actually, could you then start to pick up within the ACTS study changes that are happening across the system? And in this case, that was a change. That was the period when the period of self-isolation changed from 14 days down to 10 days. And it was associated with this little drop that we saw there in people's confidence to self-isolate. But then it picked back up again in subsequent weeks to the same level, and indeed higher than it had been previously. So I think this is really interesting that this kind of approach had really been able to identify these shifts and changes within the system. And it was interesting at that point, the discussions and the debates that we were having around the insight from ACTS in light of some of those changes. So that was the good news. I think in terms of the confidence, that's a good news. But what we also picked up over this study and over this period, and since this first 8-week period of the study as well, is that there's obviously a group of people for whom self-isolation, as Christian mentioned at the start, it's a challenging experience. And almost consistently, that's been around about 1 in 5 people have been saying that self-isolation is a challenge, and it kind of moves up to almost a quarter of people in certain weeks. And I think there's some really important things there that we really want to try and pick out, because it's okay to start saying, well, actually, 1 in 5 think it's going to be a challenge to self-isolate, but what are the specific challenges that people are perceiving that they'll have as they enter that period of self-isolation? So this is just a couple of days after people have been told you're going to need to self-isolate for either 14 days or 10 days, depending on which time they're kind of entering into the study. And I think what's really clear from ACTS is, anxiety, mental health challenges are the #1 reason why people had perceived self-isolation to be a challenge. Then looking after children, concern about the impact of work and business, and financial challenges. And then you can see kind of moving down the graph there, caring for vulnerable people, but then also having an underlying health condition or disability. Now, one of the really interesting things, I mentioned this very briefly at the start, is that ACTS enabled us to sort of make changes as we identified particular issues that were coming up in what people were saying. And one of those key changes that we made was we started to look into the other category. And this is something that's quite interesting. We had an other, and then people could write in a free text response there about what were the challenges that people were experiencing. And it's always really good research practice to add something like that in, so that you can actually see, have you captured everything that people are experiencing? And in this case, we hadn't captured everything, because when we dug into the other category, what we were seeing in there was a lot of reference to people finding it really challenging to care for their pets or to walk their dog, and these kind of issues. And so what we did just before Christmas, when we made some changes to the survey to add in the questions about bubbling, was that we also added in a category there about caring for pets. And ever since we did that, that has been the #1 challenge that people say they will experience at the start of a period of self-isolation. So it comes above anxiety and mental health problems, looking after children, all of those that are on the screen now. Caring for pets has consistently been the #1 challenge. And that's something that we didn't necessarily expect. The challenges here were challenges that were taken directly from some of the guidance that was issued by Welsh Government and others. Around actually these are the things that we think people might find a challenge, so actually have some conversations around these, but actually would not really focused on pets and animals to the extent that has come out through the ACT study. So that's been a really important finding. When we look through those that were listed on the graph, what we can also see is when we break it down by groups, you know, the people are not experiencing the challenges of self-isolation all the same. There's different groups of people who are clearly experiencing considerable challenges of self-isolation. And this is where we start to think about actually how can we support people, and that was always the intention with ACTs and cabins, as Kate will talk about in a second. Really, the focus on this was kind of recognising that self-isolation is challenging. What we were experiencing, what we were hearing was that it's a challenging thing to ask people to do. So in terms of suffering from anxiety or mental health problems, particularly women and those who were younger, and those younger age groups were saying that that was a particularly considerable challenge for them, and it was significantly more likely than others to experience that challenge. Looking after children, it was our people within Black, Asian, minority ethnic communities and groups that were experiencing that challenge, and those who were 30 to 39, as well as those living with others. The concern about the impact of isolation on work and business, and also financial problems, tended to be those in the middle age kind of categories between 30 and 49, and then BAME groups and men. And then the people who, the caring responsibilities for vulnerable people who couldn't stay with friends and family, women were more likely to express that as a particular challenge, and those who were 40 to 49, and you can see the other ones that are listed there as well. So really what this does is it provides with this really important insight right at the start of somebody's period of self-isolation, which allows us to kind of shape the response and shape the support and shape the communications to try and help people to overcome some of these challenges to be able to then self-isolate effectively. So what I'm going to do now is I'm going to hand over to Kate, who's going to talk through the cabins study, which is for those who have already completed a period of self-isolation.
Thanks, Richard. So as Richard mentioned, so I'm Dr. Kate Isherwood, and I'll be talking to you today about the other study in our Behavioural Insights programme, which we've called Cabins. And as Christian mentioned earlier, that stands for Contact Adherence Behavioural Insights Survey. Next slide, please, Richard. So cabin works so that, as Richard mentioned, everybody in the survey that participates has completed their self-isolation period. So the way the kind of whole process works within NHS Test Trace Protect is that firstly an individual is identified as a contact through NHS Wales Test Trace Protect. This person is then required to self-isolate, and as Richard mentioned earlier, this changed slightly in December from 14 days to 10 days, and it means that our participants in wave 1 were asked to self-isolate for 14 days, and then in wave 2 this was then reduced to 10 days in line with the Welsh Government guidance. And after their self-isolation period, the individual is then contacted by an external research agency which we've commissioned to complete our telephone surveys, and they're asked to complete a telephone survey. So at the end of the survey, the individual can then consent to take part in a follow-up focus group, and that just enables us to gather some further insight on their experiences of their self-isolation period. And alternatively, at any point throughout this entire process, the individual cannot give their consent and they won't be contacted again. Next slide, please, Richard. So as I mentioned, this whole process is conducted in 2 waves. So wave 1 focused on contacts who were asked to self-isolate between the 14th of September and up to the Welsh fire break last year on the 22nd of October 2020. And these telephone interviews with those contacts were conducted in November and December last year. Wave 2 focused on individuals identified as contacts between the 13th of December 2020 and the 16th of January this year, so over that Christmas period. So it meant that we had 2 weeks before Christmas, the Christmas period, and then 2 weeks after the Christmas period. And these interviews were conducted in February and March this year. But like the ACT study, we decided to kind of just focus on one particular point in time for the report. So for the report that we published and for the rest of this presentation, I'll focus on the 18,500 eligible contacts from Wave 1. And of these, 5,092 were approached to take part in the telephone survey, and 1,011 agreed to take part, which gave us a response rate of just less than 20%. Next slide, please, Richard. So as part of the telephone survey, one thing we tried to get a measure on was how many of these contacts adhered to self-isolation. And we did this by asking participants how many times during their self-isolation period they'd left their house. And participants self-reported this on a scale from none to every day. Overall, we found that adherence to self-isolation in Wales was really high, with 78% of our contacts in the sample saying they did not leave their home during self-isolation, and just less than 10% said they left the home once, and roughly 4% said they left their house every day. Next slide, please, Richard. So alongside the adherence statistic, what we tried to do was to understand the factors that made someone more likely to adhere to self-isolation over another. So to do this, we conducted logistic regression models and adjusted for age, gender and deprivation. And we found that contacts with high levels of support from family and friends and a high level of confidence in their ability to self-isolate for the whole period were significantly more likely to report adherence to self-isolation. And those questions, the support question and the confidence question, again, were measured on a 7-point Likert scale, from not at all to very much so. And what we did was just cut the data to create a binary confident, not confident variable. And what we also looked at was a chi-squared analysis, which also showed us that those who were least likely to report adherence to self-isolation were those in the most deprived quintile, those who were living alone, and those who were without children in the house. Next slide, please, Richard. So of the 225 respondents who self-reported that they did not adhere to self-isolation, 42.3% of these said that they left their house for exercise. And other reasons in the top 5 were to get a COVID test, to shop for essentials or groceries, to walk the dog, to collect medication, and to shop for non-essentials. Next slide, please, Richard. And again, like Richard was explaining with the ACT study, what we looked for was reasons for non-adherence between socio-demographic groups. And what we found was that those living in the least deprived areas and who were of older age were more likely to say that they'd left the house for exercise. And this, importantly, was significant after we'd controlled for age, gender, deprivation, income precarity, and whether they were living alone. Uniquely, as part of this telephone survey, we added in a measure of income precarity into our survey. So the measure is a validated tool, and it asks participants to self-report their income, whether this income covers their basic needs like food or bills, and unforeseen circumstances like a car breaking down or like whether somebody needs a new boiler. This then gives us a composite measure of financial security for every individual in our population that we surveyed. And what we found was that those who were of highest income precarity or were least financially secure were more significantly more likely to report that they left home for shop for essentials and to collect medication. And this is really important because what we then found in the follow-up focus groups was that these individuals couldn't stockpile food for the entirety of their self-isolation period. So what they would normally rely on would be kind of little shops throughout the week, but during their self-isolation period, they couldn't rely on that. So they were more likely to say that they left home for essentials and to collect medication. And what we also found was that those who lived alone were also more likely to report that they left home for caring responsibilities for vulnerable adults outside the household. And again, this finding was significant after we controlled for age, gender, deprivation, income precarity, and living alone. Next slide, please, Richard. So we also asked all 1,011 participants to report the challenges that they faced from self-isolation. So we thought this was really important to gather insights right at the very beginning of self-isolation, what people thought was a challenge, and then gather insights at the end to see if they matched up, so the challenges that people thought they'd face were the same as what they actually did face. And the way they did this was that we had a list of 15 possible options that were drawn from the British Psychological Society's guidance on self-isolation. And from this, we found that the most commonly reported challenge to self-isolation was wanting to see family, which was closely followed by wanting to see friends and a lack of exercise. A third of our sample also reported loneliness as a challenge to self-isolation, and roughly a quarter reported mental health difficulties. Around a fifth of our sample also reported financial concerns, living with others who are not self-isolating, and caring responsibilities for vulnerable adults outside their household. Next slide, please, Richard. So once again, what we tried to do was look for these differences and challenges that different socio-demographic groups faced. So we found that women were more likely to experience mental health difficulties and were more likely to say that seeing family was a challenge. People aged 40 to 59 were more likely to say that caring responsibilities for vulnerable adults living outside their household was a challenge. Young people were more likely to report loneliness and a lack of exercise. Black, Asian and minority ethnic groups were more likely to experience loneliness. And people with high or very high income precarity, which is the measure of financial security that I mentioned earlier, were more likely to have experienced financial challenges, mental and physical health difficulties, loneliness, and also to report that work had not supported them to self-isolate. And also people that were living alone were more likely to experience loneliness. Next slide, please, Richard. And what this looked like, again, when we kind of ran logistic regression models, and what this looked like was that women were roughly 2 times more likely to report mental health concerns. Black, Asian, minority ethnic groups were roughly 2 times more likely to experience loneliness. People who lived alone were more than 2 times likely to report loneliness. And also people with high income precarity who had that list of challenges that they experienced as self-isolation were nearly 8 times more likely to experience financial concerns than their more financially secure counterparts. 2 times more likely to report a lack of support from work to self-isolate. Nearly 3 times more likely to report mental health concerns, twice as likely to report physical health difficulties and to experience loneliness. And what I'll do now is just pass you back to Richard so that he can kind of contextualise all of this, bring it all together and provide some considerations for action for future policy.
Thank you very much, Kate. Yeah, so I think that I mean, what you've seen from both of the studies is really important, and there's some commonalities across them. And this is where I think that the real strength comes from both the immediate real-time data collection, but then that more in-depth work through cabins. And what we did was we kind of synthesized all of these findings, brought them all together to try and think, well, actually, what are the key things that we need to be focusing on? And as I kind of mentioned, a lot of the findings from ACTS were actually feeding into the system across our colleagues and through our colleagues in Wales, right from the first week back in November, and that's shaped the communications and other sorts of messaging and things as well. But I think there's really 2 key areas that the findings from ACTS and cabins point to in terms of developing the work. One is reinforcing national communications that keep Wales safe, and the second is about developing and targeting support for those experiencing the challenges while self-isolating. One of the things that we found in terms of the national communications is that confidence to self-isolate was really quite high, and that's a really positive outcome. That's a really positive message. And what we also found that was that confidence to self-isolate was really key to subsequent adherence to self-isolation, which was itself quite high at 78%. really a lot of the literature and a lot of the evidence in the earlier phase of the pandemic was really saying that people did not self-isolate, and the numbers there were really small, in the 10s and 20s in terms of percentages of people that actually did self-isolate. And what we found was that was up to 78% within Wales. And I think that's really important that that was communicated, that the high confidence that then feeds into high adherence was reported. But then there was also specific lessons that we drew out of ACT that was really important in terms of feeding into national communications. And there was 3 key areas, and this is something that Welsh Government have done. You may have seen these little videos that have been produced directly as a result of the ACT's findings. And there's 3 key topics, and you can see how these link back to actually what we've been talking about this afternoon. So the first one was really around mental health and mental well-being during self-isolation. The second was really around pets, and this kind of finding that we had from ACT once we started digging into the other category around caring for pets being important. There was some specific messaging targeted towards how can people look after their pets safely while they're self-isolating, and particularly those who don't necessarily have access to green space in terms of their gardens. And then also the availability of financial support. As Kate was saying, you know, one of the really key findings that's come out of all of this work when we look at it in the round is around the issue of financial income precarity, and that group of people who are not able to support basic needs or these unexpected events like self-isolation. And some of the findings there around how people manage finances, manage shopping and these sorts of issues, and then how important that financial support to self-isolate really is. And there's a separate piece of work that we've been doing alongside our colleagues in Welsh Government specifically around financial challenges and particularly around the self-isolation support scheme. But that was another key area for communications that's subsequently been developed to really try and encourage people to be aware of what support is available to them to be able to self-isolate. And in terms of the more targeted work, you know, we brought this together into this sort of grid really to try and think through the key areas that by bringing together the findings from ACTS and from Cabins about what we should be doing next to support people to self-isolate. And I think that this becomes a really important question, and an increasingly important question as we move into this phase of the pandemic. And you know, people are obviously still being asked to self-isolate, even though we have, you know, an incredibly successful vaccination programme across Wales. And that means that, you know, people are still going to be asked to self-isolate, and that means it might become increasingly challenging for people to do that. You know, self-isolation in the context of national lockdown is somewhat different to self-isolation in the context of a summer when those lockdown measures are eased. And so in terms of some of the more targeted measures that we need to really focus on, is the first one there is around mental well-being and social support. And the range of different groups there, you see women and BAME groups, younger groups in particular, people living alone, and as well as those with high income precarity, we're really experiencing the mental health, mental well-being challenges of self-isolation. And one of the things that we're looking into at the moment is actually what are the sort of longer term impacts of self-isolation, and actually, you know, particularly for those who are self-isolating on one occasion, or people who have had to self-isolate on a number of different occasions, either because of the nature of their work or their home circumstances. You know, this is not, for some people, a kind of isolated one-off kind of experience. The second kind of area that really is key focus is around increasing financial support and access to food and medication. And this is another really good example of how the insights from ACTS and Cabins have already fed in, and so the various different work that's ongoing within Wales around providing financial support, but also different forms of support. So different forms of food delivery support, different forms of how do you get medication, and a lot of these other aspects of support that forms part of that protect element of test, trace, protect. And the third key finding there was around exercise at home options and dog walking services. That comes from ACTS, but it also comes from findings from Cabins, where exercise was the reason why people were leaving the house. And interestingly, in some of our qualitative work, people were talking about that and how they kind of minimise the risk, but nonetheless, it's still not permitted through the regulations. And then the fourth key recommendation there was around enhancing social care provision at home, and this was specifically focused on older adults and people living alone, but also to some of those findings there around people who found it difficult to self-isolate. Either they didn't adhere to self-isolation because they had to care for vulnerable adults, but then also found it challenging because the people that they cared for were at some distance. And actually, in some other work that we've done more recently, we've explored the experiences and impacts on those who have caring responsibilities for others as well, and not just in the context of self-isolation, but more broadly across Wales. So that really brings to a kind of close and what we've been talking about today. And I think that the report that we've drawn on some of the findings here is available. It's there. We can ensure that those links get to the participants today, and it's obviously available in Welsh and English. And we're quite happy to take questions and further discussion around what we've shared. So thank you very much for listening.
Thank you very much, Richard and Kate, for a really illuminating and fascinating presentation. If people do have questions, please put them in the question and answer box. Just a quick observational question from me. Firstly, I was just wondering, did you capture anything? So you talked about actual behaviours and confidence around self-isolation. Did you pick up anything around actual beliefs that if people do follow the guidance, it's an effective way of reducing either risk to their families or to the community?
That's a really good question, Christian. Actually, that is one of the questions that we have in both the ACT study and the Cabin study, was whether people believed that self-isolation was an effective means to stop the spread of COVID. Yeah, actually. So I think that's it's certainly built into that, and that's something that we've been looking at as well. So yeah.
Great, thank you. So we've had a question, so I think this relates to the ACT study. We've had a question that if a person didn't, so you sent a series of texts, if they didn't reply yes to the first text, did they receive the second, third and fourth texts?
And no, they didn't. No. So if they didn't opt in at the start to the survey, then then they wouldn't receive a further text message. And if they didn't respond to, say, the first message, then they wouldn't then subsequently get the second message. So there was that kind of, so that people could decide whether they opted out all the way through. So for some people, we have, we've got more confidence data, and you can see that in some of the numbers actually than we do have completed surveys at the end. So yeah.
Okay, thanks for that. And another question we've had is, so what data did you collect about the individual to ensure that the survey is representative of the population as a whole? In particular, the more people suffer from anxiety and have other challenges, the thought was that they're maybe less likely to respond to the survey.
Yeah, this is a really, really good point, actually, and a really good question around representativeness, because I think one of the key things is that we can't really say that the ACT's participants are representative of the population, and because I think there's a number of different reasons, that particular reason being one of them, but who actually opts into the survey. And there's the key thing in ACTs where people have had to say at the start that they opted for SMS follow-up, so a text message follow-up. Now there'll be particular groups of people who will ask for SMS follow-up versus telephone calls, and that might be to do with issues around digital exclusion or mobile phone coverage and these kind of issues as well. One of the advantages, though, of the way that the study is designed, which is worth highlighting, is that because there is data within the system that holds information about all contacts in Wales and some core information, so particularly around people's age and their gender and ethnicity, although it's less around ethnicity. What we can then do is we can then explore who is more or less likely to have responded to the ACTS survey. And what we found is actually that those who were more likely to respond to ACTS tended to be women, and they tended to be those in sort of a 50 to 59 sort of age bracket, so tend to be slightly older. So we're missing some of the younger groups. I mean, there is not representation, but there is people that have participated across all of the different spectrums. But But what we can say there is then it gives us a bit more confidence in actually who it is that has responded to acts in a way that often you don't actually know who doesn't respond to a survey. So that's one of the real advantages of the way that it's designed by linking into the data that we have through NHS Test, Trace, Protect.
Okay, thank you for that. We've had a question about, and I think they may be in the reports, but where can we access the key messages, like looking after furry friends? So where can the audience access those?
Oh, the videos. Yeah. What we can do is we could say we could. So they're sort of they're around social media. I will need to try and find them on social media. They're bouncing around social media. Basically, that's some videos that have been produced by Welsh Government that then they feed through to various different people across Wales, the different teams across Wales, and then they can use them on their own social media accounts and things like that. But they'll be they're on social media, so they can be found there.
Okay, got a few more questions. So one question is, why is there not support for mental health for over 70 in your targeting slide?
In the targeting slide. Oh, right. Okay. Yeah. No, I think, well, the key there really is, I mean, obviously mental health is important for all of the age groups, but what we're trying to tease out there was those groups that were significantly more likely to be able to be saying that that was an expressed need. So it's not that we're excluding certain groups. I mean, I think in terms of mental health challenges that people have experienced, I mean, you know, it's consistently a quarter of people are saying that that's a challenge, and that's something that we've picked up in our second wave of the survey as well. That's a consistent figure, and so we really need to, you know, that's something that we need to focus across this. It's really about how do we identify the support that might be needed more immediately when people are having those particular conversations with contact tracers, and how do they actually then have that conversation? What do they have that conversation about with certain groups of people? And it's trying to direct some of that, but it's absolutely not to exclude everyone else from that, because I think that, you know, that is one of the things that we're now recognizing from this study and other various different pieces of work, that, you know, the course of the pandemic has been very, you know, very challenging on people's mental health and well-being in the round, and actually in terms of the extent to which that will be a longer term impact of the pandemic, then that's, you know, that's working its way through, and I think it will be, and I think actually particularly as people kind of ease back into society, I think that in itself is something that might actually be a source of real kind of anxiety and worry for a number of people. Yeah. A linked question around mental health is those respondents who cited mental health challenges, was any specific communication sent to them, i.e. any support services or anything like that? Yeah, so the conversations that the contact tracers will direct individuals to particular sources of support, you know, whether it's you know, particular telephone lines and, you know, these kind of issues, as well as actually in the course of the survey that we did. Obviously we were very mindful that when people were being telephoned about their experiences of self-isolation, that in itself can potentially cause people to feel anxious or worried or concerned. And so actually that we directed people to support where they needed it and where they said they needed it in those situations as well. Yeah, oh great, thank you. We might have answered this question, but it was the questions around, is financial support available multiple times if people have to repeatedly self-isolate? Do you know that? Yes, it is. It's yeah, you could access the self-isolation support grant up to 3 times. So so it is available for people who have had multiple periods of self-isolation. So yeah, it is. Yeah, and just another thought for myself. I was thinking about some of did you really drill down into some of your analysis in the different types of self-isolation behaviours? So obviously some you mentioned around going to the shops, but I'm thinking also around other behaviours such as sharing towels, other parts, quite nuanced bits of the guidance. Yeah, that more comes through a lot of the qualitative work, and that's not really what we've. But there is a lot in there actually around from our focus groups around actually how people manage day to day really to self-isolate, and there's some really interesting issues that come up there about how people themselves minimised risk. You know, so they recognise that actually how people manage that risk of self-isolation, or even if people did have to did leave the house, actually how they minimised risk in doing that, even though they're not permitted to by the legislation, but the decisions that people were making to kind of try to minimise that risk at the same time as knowing that they were doing something that that wasn't really within the regulations. So.
Okay, thank you for that. And we've had a question about in terms of our resources for mental health available in a number of languages for BAME communities. And is anything being provided to third sector organisations to help these particular groups who have raised the issue of mental health challenges?
Yeah, so this is where it comes. It links into the contact tracing teams across Wales. So the folks that are directly working, and I know there is a lot of work ongoing actually around BAME communities and how to link with BAME communities, not just to get the messages through, but to provide those sources of support. But that's the sort of on the ground sort of action that's taken by the local authorities in the main, who are responsible for the protect side of test, trace, protect.
Yeah, thank you very much. I think that's all the questions we've had. I don't know if there's any final comments you'd like to make, either Richard or Kate.
I'll let Kate make a final comment because I've sort of dominated the question. So I think, yeah, that would be, if Kate wants to kind of sum up.
Yeah, I don't think I have much to say, to be honest, apart from just it's been really nice to come and share what we've found, and also just to highlight some really important groups that we think need targeting support, which I think is really nice because sometimes that can get overlooked. But no, if Richard's got anything else to say.
No, other than to thank everyone for coming along today and listening to what we've been doing. This has been our work for quite a number of months now, and so it's really great to be able to share that. And if there is any subsequent questions that people have and comments, then quite happy to be contacted.
We've had a last minute question coming in, so I will ask this one. So this is a question around how confident do you feel that people were telling the truth in the cabin survey in relation to their actual behaviours?
I think that's a really good question. I mean, I think the way that we designed it was, to be, and that's partly why it was an external market research company that did the actual telephone survey, because we recognised early on that if we phoned up people and said, hello, we're Public Health Wales, are you following the rules? Then actually people would be more inclined to, you'd get that bias within that. I think actually what's been really interesting recently is some conversations that we've been having with our colleagues across the UK. There is different pieces of work that are ongoing around self-isolation among contacts, both in Scotland and in England as well. And what's quite staggering actually is that the sort of statistics that we are seeing around adherence are very similar across different countries, but also with quite different study designs and asking the question in slightly different ways. One of the challenges with this work is that there was no measure of self-isolation adherence when we started, so we had to develop that, and of course everybody was developing their own pieces of work concurrently. And so subsequently, actually, when you try and join the dots up a little bit, you see that there's quite a bit of consistency. And then also we look at the sort of first wave and the second wave of the survey, and there's consistency there as well. And as well, in terms of the number of people that are saying that they're going to experience a challenge at the start of self-isolation, but 1 in 5, and then you end up with a figure that's kind of about 22% of people that didn't adhere to self-isolation, which is not too dissimilar. So I think that I'm fairly confident that people were actually telling the truth, and having that sort of sliding scale of being able to give people the option to say, well, I just left once. It doesn't feel as much as saying, well, actually I left every day, and there might be a wee bit of slippage there. I think what's also interesting is the qualitative data kind of backs that up a little bit as well when you dig into the details, and people have been very candid in some of the qualitative work as well, so it suggests that people were candid in the telephone surveys too.
Yeah, so it sounds triangulating and corroborating different sources is kind of pointing to that it is likely to be pretty valid.
Yes, yes.
And just to kind of add to that, what we did at multiple times through the survey was just to reassure people that it's like fully anonymous as well. So it just kind of enabled them to be as candid as possible to ensure that kind of no repercussions were coming back to them. And as Richard said, it helped that we had an external research agency to do those interviews for us as well.
Yeah, great. Well, thank you ever so much, Richard and Kate. That was, as I said, a really detailed and really fascinating set of studies that you shared the findings with. We'd be grateful if anyone who's joined us today for the webinar would complete a short evaluation, and a link to you will be sent. And we hope that you will join the Public Health Network Cymru if you're not already a member. And we would always welcome any final thoughts in terms of future webinars in our COVID series. So thank you ever so much for listening today, and to our speakers once again. Diolch yn fawr, thank you.